Welcome back, pet parent. I am excited for today's guest. We're talking about a couple of things that we have never talked about on this show before. And so let me go ahead and welcome Dr. Zach Pilosoff with us on the show today. Thank you so much for being here with us. How are you doing?
Doing good. Yeah, I've been watching a lot of the episodes you guys have putting out. So, so far it seems like it's been, pretty successful. You got some good people that have come on here. So, happy to kind of be able to contribute.
Yeah, no, I appreciate it so much. So, you do a couple of things that I have not talked to anybody about in the past. One is emergency veterinary medicine, and the other is fear free medicine. And so I'd like to talk about both of those. But before we get into any of that, I'd just like to hear a little bit about you and like the backstory and how you became a veterinarian and do what you do. All right, pet parents, you already know that I talk all the time about needing to stop as much as we possibly can feeding our fur babies garbage. For lack of a better word, that's what we talk about here a lot. And again, doing the best we can. That is the message above any and everything else. The more we learn, the more we know we need to make some changes. And this episode is powered by Legacy Biome. This is no BS. And this is why I think you need Legacy Biome. So, Legacy Biome offers premium. When I say premium, I mean premium FMT, fecal microbiota transplant capsules. These are products for your dog designed to restore and support a healthy gut microbiome. Yes, you heard me. Top tier microbiome therapy straight from nature's playbook. Gut health isn't optional. We talk about this all the time. It's not optional. It drives digestion, immune strength, allergy resistance, mood, and even chronic disease risk. So if your pet's gut is out of whack, their whole system is out of whack. If you learned nothing from me thus far, I think you should know that. So Legacy Biome tells us that their donor animals live on a raw, organic diet in pristine, chemical-free environments, generations bred to preserve a rugged and unaltered microbiome. No antibiotics, no pesticides, no synthetic crap ever. And they screen those donors with the strictest protocols in the industry. Kim's over here next to me, if you can hear her. So if you have a pet that is wrestling with chronic diarrhea, itchy skin, hair loss, allergies, rebounding from antibiotics, that's a thing too. Legacy Biome is your weapon. Heck, you can just use it proactively to build a bulletproof gut and immune health. So don't worry, vets handle this. FMT is administered rectally often through veterinarians' offices, but we don't always have access to that. So what's the next best thing? FMT capsules that are enteric coated that you can get delivered straight to your home from the most pristine donor dogs ever, from Dr. Margot Roman, as a matter of fact. So, top integrative vets across North America swear by Legacy Biome. That's not hype, that's physician grade endorsements. If you're ready to stop the gut wreck and start the comeback with your dog, head to legacybiome.com. That is legacybiome.com, legacybiome.com, and get some for your pet. And by the way, let me know how it goes. You know me. You can always reach out to me on Instagram. I'm here to talk to you all the time. I want to know. Let me know about it.
To try Legacy Biome for your dog, visit legacybiome.com and use code TPPR10. That's TPPR10 for 10% off.
I'd just like to hear a little bit about you and like the backstory and how you became a veterinarian and do what you do.
Yeah, for sure. So at least, becoming a vet and starting at the very beginning, I definitely can resonate with a lot of people out there that feel like they understand animals better than humans. I don't know, human behavior sometimes is super confusing. So animal a lot easier to understand. So, it was always kind of like one of the plans in life. So, but as a vet, I started out pretty much like I'd say almost every single vet, kind of conventional route, conventional vet school, and coming out of school had a plan. And where I'm at right now is definitely a very opposite or different plan than at least I thought I initially envisioned where I was going. Initially, I had thought I was going to be a veterinary neurologist. So that was the path I went down and started with, and then found out on that path that it probably just wasn't for me. And simultaneously, I actually started to find an interest in cannabis as a potential therapeutic. And so that was the first thing that opened my eyes a little bit to the idea of integrative and holistic therapies that could be complementary to and work well with the things I just been taught for 4 years of vet school. And so, through that route of kind of finding that path was maybe not the one I was intended for, in addition to starting to become a little bit obsessed with the idea of cannabis as being something we should think about as part of treatment plans in the right setting, then that was what pretty much opened the doors for me as thinking that there was maybe more than one way to go about things. And so through that theory, then that open mindedness allows me, anyone pretty much, to kind of start to see that there are other options out there. It's more about the proper usage of it and timing. There's a time and place for everything. And so that's a motto that has allowed me to find a way to do both, your classic standard Western medicine in complement to some more integrative, holistic approaches that I think make sense in other situations.
Yeah, I'm glad you brought that up because I mean, obviously I have had people on to talk about cannabis, or I prefer to call it Kimberly. I'm sorry, my dog. She's just going to take advantage of the situation. She's going to eat my cat's food. So I try to, me personally, I've been really trying to kind of shift my vernacular into saying full spectrum hemp extract.
Mhm.
And there's a lot out there. I just am of the belief that a full spectrum extract is kind of what is going to be best case scenario. And there are different ways to look at it. I've talked to a couple of different people who are doing full spectrum in different ways. It's very interesting to me how the endocannabinoid system being the master system of the body. Like, I don't go a night now without me personally taking it and giving it to my dog. And I wish I were better about my cats, but cats being cats are, they are what they are.
Yeah.
But how do you, especially being in like emergency medicine, how do you utilize cannabis with your patients?
Well, right now there's so much that goes into the cannabis space and even the hemp space. Like it's not really something still that Western medicine is okay with. So to be
Yeah.
honest, in an emergency setting, I don't really use it too much. But what I often have the opportunity to do is, I'll kind of evaluate how a pet parent is like talking or what they've tried historically, and if I think that they sound like there's someone that is interested in hearing about some options that maybe make sense going forward or in the same setting could be helpful. We get a lot of pets nowadays that I'd say, in line with animals that are getting allergic skin disease, that a lot of animals have anxiety nowadays for whatever reason in kind of the same path as humans. So, but, obviously anxiety is one thing that really works with a lot of pets. I'm sorry, that is found in a lot of pets, and cannabis or, full spectrum hemp is something that has worked for a lot of pets in that situation. So a lot of times, I'll look for reasons to kind of open the door to that conversation in the emergency room. But uh, in reality, right now there's a lot of regulations that are preventing most veterinarians in the country outside of a couple of states to actually discuss that a lot in the clinical setting. And so it's
Yeah.
kind of a little bit of a gray zone where you're allowed to not only discuss it, but more utilize it. And so, right now there's actually only one state that actually defines that pet parents can utilize hemp in practice, which is Nevada. California has a lot of regulations that make that help with kind of discussions and recommendations when it comes to the medicinal side. But for the most part, really, out of the other 48 states or so, it's a lot. It's a juggle and a gamble as to what veterinarians can do in the clinical setting right now with, cannabis-based product, whether it is medicinal or full spectrum hemp.
So if veterinarians are so like they have their hands tied almost,
Mhm.
then we kind of have to utilize. I know there's one company that recently got a letter from the FDA that I'm so upset about. We're going to talk about that on another podcast. But they're cracking down. Granted, there are arguments to be made on both sides with, making claims, and we don't need to get political with the FDA, but it has to be really, really difficult to be a veterinarian and to see something that works so well and that you feel like you can't even talk about it with your clients.
That's a lot of stuff. I got, 10 plus supplements that I could probably think about that have been stigmatized for the wrong reasons. Whatever one people in this community want to hypothesize, I have my own theories, and I think that everyone that is open minded or looks for things that are more natural has their own theories as to why. A lot of things at work do get stigmatized and judged, both in I guess more in the media, but also politically. So
Yeah.
it is a hands tied kind of situation, in long story short. So you have to be smart about, well, first you have to educate yourself and understand what you are allowed to say and what you are not allowed to say and what you are allowed to do and not allowed to do. And so I did kind of attack that pretty quickly in the space once I knew that that's the way the game was going to be played. I worked pretty hard to kind of know what I can talk about and not talk about. And so, but I could see for sure that most vets, when they are hearing a lot of things about there being success stories, but they don't know what they can legally do. And of course, I'm assuming, it's got to be a little bit of a fearful situation. Vets are going to most often, which rightfully so, are going to take kind of the conservative route behind it because in veterinary medicine, veterinarians, unfortunately, and I found this out myself, are guilty until proven innocent in situations. So, it's hard for us to stick our neck out a lot of times. And when it does happen, and we try to do the right thing, sometimes,
Yeah.
it puts a lot of risk for our license. So, I can understand why a lot of vets are still pretty hesitant to talk about it.
Yeah. And I appreciate that perspective so much because I mean, we talk all the time about vaccinations and over vaccination. And I personally have been chastised by multiple veterinarians for not doing vaccinations. They don't agree with titer testing, which just blows my mind. And then also, flea and tick and heartworm and all the things. And I can't tell you that it's going to be okay if you feed your dog a raw food diet, even though you've been feeding your dog a raw food diet for 10 years and they're perfectly healthy. Like all of those things.
Yeah.
It drives me up the wall, but I appreciate the other side of that, like where you're just concerned about your license and you want to keep practicing medicine.
That really is. I mean, I have, not to get too much of it, but I've been reported multiple times for things that they get dismissed with like no consequences from the board. But it's, people nowadays, there's really good people out there, and then there's people that have a different agenda or a different mindset. And so it's scary, honestly, as a veterinarian, because that's your livelihood. And so the only
Yeah.
thing a lot of times that we worry about is like, should we do this? Is it worth it in terms of like, are we going to get backlash, or is this going to put my life at risk? So yeah, it's a reason for why a lot of vets probably are taking, would take a conservative approach about wanting to be okay with things. I think there's also other factors and it's always individual independent. So, but it is a thing that I think is on the back of most veterinarians' minds. But anyway,
Yeah.
yeah, go down that route too much.
So, what happened that got you interested in cannabis to begin with?
Well, so I was actually in my neurology internship at that time. And, obviously, kind of mentioned anxiety is something that has responded a lot of times favorably to cannabis therapies or cannabis based therapies. So I we're getting a lot of pet parents in though that we're also talking about seizure control as well as pain control. In neurology, there's both the two main sections, brain and the spinal cord, and so we see a lot of pets that are experiencing obviously seizure disorders as well as pain related disorders, and then third would be cancer based diseases. So those are three things that have shown a lot of promise with cannabis based therapies, and so we were getting a lot of questions and I was getting a lot of questions and I was like, I can't answer any of these questions. So, and then I was just curious. I don't know. I've always been kind of curious about things versus writing them off. And so I started doing a little bit of research, on, what was happening in the human space. Cause I always start with the human space is kind of something that I've always found has a little bit more information that can help me figure out if something actually has a legitimate side or not, or if it is a discussion topic with two different opposing ends. And so I found obviously if you do a 10-minute search on PubMed, what's out there, which is the tens of thousands of papers. And so I was like, oh wow, this is pretty concerning that I never got taught this. And so that was kind of the snowflake that led to the snowball effect. And since then that was really where I was like, oh gosh, I need to understand this stuff because it looks like the human medicine space has been secretly utilizing this since 1960s, maybe not, well, maybe research since 1960s, but 1990s is when the utilization ramped up, the research ramped up maybe in the 60s. So we were far behind in vet medicine, and I wanted to try to catch up.
Yeah. Yeah, well, until, pharmaceutical companies figure out a way to profit off of it, they're not gonna let us know about it.
Yeah.
That's my opinion. Yeah, what's interesting is that it does so many things. I definitely have used it for clients with seizure disorders. I absolutely use it for anxiety, like you talked about. And then I have used it for pain. I had a cat, I had to let him go last year. It was interesting because in March, he had his annual, senior blood panel. Everything looked great. And within 2 months, he broke his leg. And that was the first indication I had. I took him in to get an x ray and he had hemangiosarcoma. And it was like, wow, out of nowhere. And I actually got THC that I mixed in with a full spectrum hemp extract. So I was like increasing the amount of THC he was getting to manage his pain. And that is what he got. I didn't do any other medication. There were no pharmaceuticals. And it was more than enough to manage his symptoms, his pain, because he was totally fine. Like, I mean, you see this all the time. Animals are like, they act totally fine. It's
Mhm.
just the pain that gets them.
Mhm.
And so it was more than enough to manage his pain. And so much so, I was actually just telling somebody this morning. The day that I had scheduled for him to be euthanized because he was just with food and everything, how it gets at the end of life. You're like, once they decide they're not going to eat, you're just done. And that day, I gave him quite a bit, and he thought he was Superman. He was jumping off of like 4 feet, furniture. And I'm like, dude, you still have a broken leg. But he was feeling so good.
Well, that's good. I'm glad he had a fun, animal.
Yeah. Yeah. He was feeling totally fine. He was like, there's nothing wrong.
Yeah.
But I mean, I think, and I say that like, obviously in the moment, it was horrible. I was a disaster. I was a mess, just having to let him go. But, I can look back on it and say that that gave me peace of mind that like he was fine. If his body could have held out any longer, he would have been fine for quite a while longer just on this without pharmaceutical intervention. And to me, it's just like one of those stories that's like, look what we can do with what nature gives us and not have to rely on, anything else. Fortunately, my veterinarian at the time was like fully on board. She was so sweet. She was like, I'll write you a prescription for anything you want, to keep him comfortable, to do all the things. But I was like, no, I think we're good. I think we've got this. I mean, he was already 17 years old, so it's not even like, you
Wow.
know, yeah, it wasn't like, a 2-year-old cat that you're like, I need to save them. They have a whole life ahead. It's like he was already 17 years old. And
Yeah, yeah.
so I wasn't gonna like amputate or anything. And yeah, yeah. But anyway, I just think it's such an amazing tool that I do wish that, but with, the federal regulations kind of clamp down on the states, and then the states are like, no, you can't, you just can't. So I hate that, but I appreciate that that's kind of what drew you into learning more about, what holistic modalities are out there. And one of the more interesting things that, again, I haven't had anybody come on the show and talk about is being fear free I don't know if there's any way to be like 100% fear free, especially considering like our pets just have a sense about them that we kind of don't tune into a lot. Cats, oh my goodness, bringing a cat even into like a cat only clinic is just like they're going crazy. But tell me a little bit more about like what fear free is and how, like, what people can expect when they're looking for a fear-free clinic. Say it 8 times over and see what happens.
No, I know it's a tongue tire, but anyway. So, but yeah, I mean, so honestly, the fear-free aspect is something that it just learning about kind of things like that. Well, actually, honestly, for me, just start off, it was honestly it made so much sense because I've really only understood animal kind of behaviors and patterns since I was younger, and the human side, like I said earlier, is never understood me. So for me, it kind of made a lot of sense when I was learning about it. I know a lot of people, um, kind of talk about it, but utilizing it in practice is actually a lot more difficult because, like you said, like it's an uphill battle from the moment that they get there. In most situations, you're working in a very um, uh, a place that has so many different stimuli that it's hard to say like, oh, this is going to be a comforting environment as best as I can do. Not taking into account the fact that most of the pets that I see are sick or uncomfortable to some degree, given that
Yeah.
mostly emergencies. What the fear free side of it does really to me is provides as much comfort, emotional comfort to a pet that we are here to try and help as best we can. And so there's a lot of things that you can kind of discuss in more of the focal aspect of the specific things you can do in a situation to try to, carry out that goal. But the goal for me when it comes to fear free is like trying to express to a pet, obviously non-verbally, that you're here to try and help them as best you can and to hurt them as little as you can in that process. The emergency room is an insane environment that I find comfort in, but probably no one, minimal people else do. So what when we're trying to take a fear-free approach, we're really trying to understand, the mental, physical, and emotional aspect of a pet. At least that's what I'm trying to do, and figure out which one of those is really the main factor as to maybe what's causing this pet to um, a fearful experience at the moment, and to address that as best we can. So, and that's I like to break it down like that because there are, those are the three general categories that whether you're a human or a pet is going to, you know, is going to be where they're experiencing anxiety to some degree, and really that's what fear free is. It's just adjusting a pet's, um, you know, I guess anxiety in a way that they're creating this hyperalgesic state, and how can we, kind of mitigate that. So whether is- that's understanding that they're better with their owners in the room, or they're better without their owners in the room. Each of that's a situation. Whether they have a lot of built up uh, anxiety pre to the exam, or pre to coming into the hospital. That's a lot of discussion that comes up. Whether they are an animal that's in chronic pain, and that's kind of the reason that they do experience a lot of fear when they go to the vet, because when they go to the vet, cranking on things, and you're trying to figure out where the problem is. And so, it's kind of understanding for me, like, where is a pet stressed or feeling anxious, and addressing it out of those three categories, and doing the best you can in the situation. Because obviously, my team has a job to do as well. We're trying to, solve a problem, and, kind of understanding that this pet is a living creature with thoughts and feelings and emotions, but at the same time, getting the job done too. And so, you do your best, and you have, a lot of tools in your brain when you're trying to do that as best you can. But I think that the teams that I work with understand that that's something that I prioritize, that it's not just about getting a pet and their family in and out the door with meds or with tests on, like, understanding that this is a living creature too, that, we should try to make it as least stressful and as positive experience as possible, so that, if they do have to come back next time, that, they're not terrified, that they understand to some degree that we're trying to help and that we're allies.
Yeah, and I think, well, I know it actually starts at home. It starts with the pet parent. Getting in the car should be for more than just going to the veterinarian's office, right? So, like, you're not making that experience bad all the time. And for cats, making sure they're used to their carrier, or for a dog, like, if they need to be used to being in a crate,
Mhm.
right? Like, because you just never know when they're gonna have to be put in a kennel, in a vet office, or and that they're comfortable being touched. It really starts at home. Like, you have to be able to do these things with your pets at home first,
Yeah.
so that it does get a little bit easier when you're in a vet office. But some of the things I've seen, and I'm just curious, like, what it translates like for you, especially in emergency medicine. I've seen, obviously, there are cats only clinics. I've seen clinics where, like, literally one side just has cat rooms, the other side just has dog rooms. There's, like, pheromone diffusers. What kind of things are you utilizing there?
Yeah, no, actually, I mean, those are some really good ones that a lot of vet officers will try to utilize. I mean, the first, like you said, is basically understanding that cats are not small dogs, and that anything that's not a cat or a dog may be prey to one of those two. So, if you do work with animals that are different species, that, understanding the interconnectivity between them, not just that they're pets and you're not pets. So,
Yeah.
that's a really actually what I think is a super important situation to understand, and knowing that, if you are commingling different types of species in the front of the hospital or in the back of the hospital, that they should be separated. So not only just in the front aspect, but in the back. I've worked with many clinics where there's just a specific cat ward, or there's a specific cat exam room that will be much quieter, that will try to be soundproof so that they're not hearing the dogs barking all the time. And if they don't have that, a lot of, again, people that work with me, that that I usually try to put cats in the back of the clinic if they're not, obviously very sick. We don't have to keep tabs on them, but if it's possible, if there isn't another room or a cat ward that I can separate them, that the anxious cats or the scared cats. Because not all cats are scared. And actually, we
Yeah.
had cats that I showed this week actually that we were like, wow, this is like a dog. That's so weird. But but in terms of behavior, but we will try to. That is something that's actually, it seems like a simple goal, but to understand that these are different species, but different relationships between them. Understanding that cats should be separated from dogs, not only just for visual reasons, but for sound reasons, smell reasons, etc. So, with cats, that's, one thing that we really try to do. And in addition to that, if we don't have that opportunity, like trying to create a safe space for them. So covering their cages, or having the windows so that they're only one way if they're in a cat ward, so that they can't see what's going on out there. But cats like to be kind of recluse away from situations. More often, not always, but more often dogs want to be involved with, or being able to see situations. Those are a couple of things that are good points, and, outside of the pharmacologic side, because a lot of times, when we talk about fear free, I feel like the first thing people talk about is pharmacology, or supplements to help control anxiety. And like, so
Mhm.
I think that the other point you mentioned is actually an excellent one that I do talk to pet parents a lot about. If if a pet comes in super nervous or anxious, is that, a couple of things you could try at home to kind of get them used to this situation, which, like you said, was starting early with taking pets on, drives or in car rides, or getting them used to um, the the carrier, or even the simple fact of putting the leash on and walking towards the car versus walking on a walk. Like, they may see like, oh my gosh, like we're putting leash on, where we're going towards the car, like I'm about to get stabbed and stretched and poked. So, that's something that, we should desensitize to over a period of time. Yeah. I mean, you made several good points as well, so I think that those are all things that we try to do, or at least propose to do, to try and help an animal to not basically associate going in the car, going to that office, as a
Mhm.
torturous event. So, but you really do your best. That's really what it's about. It's about being proactive. Actually, is the last part of it. Starting early.
Yeah, I've even had suggested to people to take their pets to like call first to make sure like whoever's at the reception desk can actually manage and handle, and it's not like a crazy situation when you walk in, but to take your dog specifically to the vet's office just to walk in, to let the people at the front desk love on them, tell them they're a good boy or a good girl, give them a treat, maybe weigh them, and then leave. Like, so that they're not always associating the vet's office with being poked and being prodded.
Yeah, exactly. Yeah, I don't think anyone at a vet office would make anyone feel bad about that. I think actually people would say we should do this more often, because yeah, I think it would help a lot. And it's, maybe it's out of your way for a couple
Yeah.
minutes, but it could make a world difference for a pet. You never know.
Yeah. And again, like I can only imagine that it is that much harder to do in an emergency setting. Um what how did you get into I mean, for me, from my standpoint, just from everything I know being more holistically minded, the training that veterinarians get in vet school I think is perfect for emergency medicine. Like that's what you're trained to do, diagnostics and emergency medicine. But like from your viewpoint, having actually gone through vet school, how did you get into emergency medicine? What sent you down that path?
Well, I guess. In vet school, it's kind of interesting, I guess, just to kind of touch on that point. In vet school, what I find actually is that most, at least in my experience, and what I would say is probably majority of experience, is that vet schools, for the most part, push you to be a specialist, and that the non-specialized primary care doctor and the non-specialized emergency doctor are kind of like not too much talked about. Maybe I'd say that where you spend a lot of your time, like on your rotations in vet school, I'd say I spent probably the most on emergency. So that is something that does happen. I guess if you don't overtly like ask to be on a different specialty service for more than that. But I definitely would say that that was kind of a natural thing. I mean, for me, I went back to emergency because my internship actually, which I always promote to veterinarians, is to always do an internship if you can the year after vet school. In human medicine, you do either a 3 or 4 year residency, no matter what, after school, which I think is important because you don't get really any hands-on clinical experience in vet school. You get observatory clinical experience and maybe get to do 2 surgeries on the and unless you do an extracurricular couple weeks where you get more experience with that. But you're really observing for the most part and being included in the most basic of aspects when you're in vet school. It's an internship is where I was thrown into the gauntlet, and I went to a very difficult internship, and which I'm super grateful for because I think that it prepared me for the world much quicker than if I would have went to one that was less interactive, even though it was a little bit challenging at times with an asterisk next to a little bit. But in vet school, I think they really push you to be a specialist, and if you don't become a specialist, which is the mindset that a lot of people come out with, then it's like, well, then you're just going to be another one of these vets that are primary care or emergency medicine. It's almost like it's downplayed as not as important. So becoming emergency veterinarian for me was actually a consequence, though, of failing to become a specialist or failing to find comfort, or I'm sorry, failing to find passion to becoming a specialist. And so my internship was in like a very advanced emergency specialty hospital up in Boston. And so, I still got exposure to a lot of the specialties, and I definitely, was still in the path of becoming one or wanting to become one at that time. But what we did there was 90% emergency medicine. So I found it fun. And though it's definitely a lot of sadder days than happier days in emergency medicine, that's a guarantee. But you find comfort in what you can address or can treat and sometimes even cure, which is not always easy. Um, which is weird to say that, most of the things you see, you can't cure, but because you're seeing a lot of pets that are mostly in the end stages of things or have gotten far advanced. The ones that are wins, you take home as best you can, and you try to see it as the ones you can help the most. You try to help the most, and the ones that maybe you're here to provide answers at least, or provide a palliative plan. That you do that as well. Emergency medicine is kind of taking your wins and prioritizing the battles that you came out on top. And in the other situations, trying to do the best you can for the pet, even if it means that sometimes it's their last day here with us.
Yeah. Yeah. I can imagine that it is pretty sad. I have such a soft heart. I don't know that I could do it. But yeah, it's one of the questions that I wanted to ask you was around like things you see coming in that maybe really aren't emergencies. One of my biggest pet peeves is with diarrhea. I feel like people freak out so quick over their pets having diarrhea. And maybe you have a different viewpoint of this, but like it happens. And like it's not always something to immediately run to the vet for unless there's like blood, but or if it's a puppy, that's obviously they're much more at risk for dehydration much more quickly. Like I don't know. I feel like that's one of my biggest pet peeves with people is like, it's not always an emergency.
Yeah. I think it's subjective, like you just pretty much alluded to, is that it's a subjective situation. Yeah, I mean, diarrhea happens to us, and so we don't
Yeah.
room, but I definitely could see that. But it's really subjective, like and that's the thing is that as a pet parent, especially more nowadays, where it's like, it's pet parent, but a lot of people see pets as their non same species child. So a lot of with your kid, you're gonna educate yourself as a parent. You're gonna over time kind of look and research things, and so a lot of pet parents in this community actually do a great job of that. through my telehealth company, actually I've come across pet parents that sometimes blow me away with how much research they've done, and they are just looking to kind of consolidate that. And so, a lot of times they know as much as me in some situations on topics. So I'm like, it's really impressive. But at the same time, it's and so that's just a testament to, like, pet parents can be super educated, sometimes as much as veterinarian can on a lot of topics. So diarrhea is a subjective situation, right? And that's one that you could research. So, and I think I did a video or guide, but I know a few vets have also kind of put videos out in terms of helping to triage at home, when diarrhea is a situation that does, may be responsive to some at home therapies, and then when it may be something that does need to see a vet. I know that, I can't remember.
I know Dr. Katie Woodley puts a lot out around that.
That's exactly what I was thinking of. Yeah, she has a bunch of blogs and stuff. I've read her things, and she has a great article actually that has several supplements on there you can have on hand at home. I also have a few that I've included. I have like a link tree on social media that I have a couple of companies that are some good products that I like to have at home for non-specific diarrhea or loose stools. But yeah, I know if it's a couple things you mentioned, if it's like a young puppy, especially if they're like in the midst of their vaccination series, their puppy series, where they may not be fully protected from some things, or the pet is starting to have a good amount of blood in it, in the stools as well, or they haven't eaten for a day and a half as well as having the diarrhea. Like, those are situations, like you said, where you're setting up not only for diarrhea, but that you may not be able to get the fluids in that you need to match what you're losing. But yeah, it's a subjective call, and so, but I think you're right that there are a lot of times that some symptoms at home can be addressed with supplementation, and diarrhea is a really good one to bring up. And you're looking for other things that can be addressed, but it is a subjective call. But there are resources out there for pet parents, I think, to kind of help them, you know, triage at home and figure out, what's the best solution at the time.
Yeah. Well, what are some things that I mean, I guess I'm curious as to, like, what you're seeing now. What do you see come in a lot?
Well, right now I'd say vomiting diarrhea has always been number one. So we see that all the time. Yeah, but out of that list, I could create 12 or 14 different things that can got you there, whether they're
Yeah, for
GI
sure.
related or not. So that's the puzzle piece aspect for me, at least for us as vets, is like saying, like, okay, this I have, you know, 3 dogs that just came in for the same symptoms, and, each one of them may have a different reason why. One might have eaten a sock, one might have a history of food sensitivities, one may have a gallbladder infection that's causing them secondary vomiting and diarrhea. So,
Mhm.
that's kind of the puzzle piece aspect that is our job as the vet side, and when a pet parent comes in with a situation. And so, out of those 3, the well, we'll say it's just diarrhea alone. Like the one in the middle, the food sensitivity pet, maybe that one could have been addressed at home with some supplementation or fasting the pet for 12 to 18 hours and offering just liquids. And then the other 2 obviously are, different situations. One's a
Yeah,
situation, one's a medical situation. So,
for sure.
but yeah, so vomiting diarrhea has probably always been number one. We see a lot of pets. I see a lot of trauma pets. I really like trauma pets. Like, I like, but I like addressing those the most, to be honest. But we see a lot of trauma. That's kind of like a common thing we'll see. Out of that, it's a mixed bag. Pets coming in for, pain that, it's hard to figure out where it's from. We see a lot of pets that have like different hormonal or endocrine disorders, some diabetic pets, if they have different levels of diabetes that's controlled, that's a common thing we'll see. We see some affair of like neurologic conditions, whether it is seizure related or spinal related. I work down in Florida a lot. So even though I travel, full time for work up and down the East Coast, Florida, there's cane toads or bufo toads down there, and they are like everywhere. So we get a lot of pets. I'd say at least one to two at minimum a week, sometimes one a day, of pets coming in, because if a pet even licks that toad, they have seizures pretty
Yeah,
rapidly. So toxicities, we see, pets eating things they shouldn't, that have different toxic variables. Yeah, it's a mixed bag, but I honestly would say vomiting diarrhea is always number one, and it probably will always be number one. So that's why it's good
yeah,
to, at home as a pet parent, be like, hey, these are the, red flags I should look for. If I haven't seen, these red flags, maybe I can kind of do some things at home. And then once you start seeing when you start seeing the red flags build up, then, good to come to that. But yeah.
yeah. How much I'm curious because it is an emergency setting, you probably it's you're either, like, dead or you're pulling your hair out, right? And, like, that's just kind of how it goes, I'm sure, but how much especially considering there is so much vomiting and diarrhea coming in, how much do you actually get to talk to pet parents about gut health?
Not much at all. And then that's why, uh, um, I think that was another reason why I kind of found a little bit of interest in expanding my abilities to connect with pet parents outside of just emergency settings. So yeah, in the emergency room, like you said, I'd say depending on the hospital you work at, I work mostly at the busiest one, so I don't really get too many dead nights or days because I guess I work mostly nights, but I guess there's some days mixed in. But yeah, I have 30 to 90 seconds to talk to a pet parent, and so
Wow.
and so it's really what's going on. This is what I want to do. Figure out what's going on if I can. If I can figure it out, I can't. Great. If I can't, then this is the next step. This is the person you have to talk to. It's very rapid fire. So Naked Pet, which is like my online business, that was something that I guess I was yearning for, was to not only be educated in integrative holistic therapies and talk about it in a situation like this, which is kind of what I was doing. I was talking at conferences and I was doing podcasts, stuff like that, but I really kind of wanted to also make a difference with it. So that's where the telehealth aspect of Naked Pet came into play, was getting more than 30 to 90 seconds to talk about what do we do after the acute event. How do we create longevity or the best opportunity for longevity with where we're at right now, given we have these certain things going on. So
Yeah.
yeah, in emergency
Yeah.
setting, there's not much time.
Yeah. I mean, I hate to say this, but it's just the truth. The worst experiences I've ever had were in emergency vet clinics.
Imagine, actually, you don't usually go there voluntarily.
Yeah, well, I mean, just like obviously this is not a reflection of you as an individual. But I have had people, and these are technicians usually because the veterinarian doesn't have time to have these conversations. Tell me that I'm going to kill my pet if I don't put him on this prescription diet. Like literally, you're just going to like walk up in my face. You're going to kill your cat. And I'm like, this is not an okay situation. And I also had one of my dogs pass away at an emergency vet clinic overnight, and they didn't inform me. So I've had some really like not so great,
Yeah, that's
not
not okay. Yeah.
not so great. Yeah. And I had another cat who it was at an emergency hospital, but they had like residents there that were doing studies, and I feel very strongly like she kept my cat alive because she wanted him in her study, even though I kept telling her I was not going to put my cat in this study. That was a bad situation also.
These are pretty dramatic. I think I could agree with this. These are pretty bad. These are traumatic events.
Yeah. So those are probably some of my worst experiences, but I still appreciate emergency medicine. We need it. It's there for a reason, right? Like our pets, things happen, and heaven forbid your dog gets hit by a car and your vet's office is closed, right? Like that's when it always happens.
Yeah, exactly. No, I mean, I could definitely understand, and I believe you 100% in, yeah. Well, the second one, I don't want to believe that one, but at least for the first one, honestly, what's helped me the most as a veterinarian is knowing that I'm here just for suggestions, and that being okay with that. Like, I find that, they want the vet industry. Everyone here goes into it because they want to help. That's
Yeah.
definitely true. The way you express that verbally and non-verbally is whether you're in a vet clinic, whether you're working at United States Postal Service, whether you're answering the phone for Apple, you know, that's the variable, is the way that human emotion acts in situations. And so I definitely believe that, the first one where, you were told that your cat would die from a certain diet happened, because I've seen it multiple times. I work with people that I know have said things like that. I'm just here for suggestions. That's the way I approach it. I think this is the right thing to do. If you don't want to do it, like it's not my pet, and that's okay.
Yeah.
No,
Yeah.
and that's on both sides. In the emergency room, go in. I make a suggestion. I make an estimated plan of what I want to do. If you want to follow it, like that's okay. Like it's not my pet. I think this is the right thing, but this is the best thing, and can't do it. You don't want to do it. That's fine with me. Like I'm not going to make you feel bad about it. You can get a second opinion and go from there. So
Yeah. Yeah.
I think guidance, and I think that allows me as like an individual as well to separate the facts from the emotions. And this is what I think is the best, but emotionally, am I going to get tied up in it? I'm not going to get tied up in it because I got 40 things else I got to do right now, and so I think this is the best thing right now. If it's not, then that's okay. We can make a plan B, or you can see your regular vet tomorrow. I'm okay with that. So I think that it
Yeah.
can become a little bit fiery sometimes in ERs where people act emotionally incorrect, even though they're trying to do the right thing or say the right thing. So I'm sorry you
It
had
is a
that.
highly, highly volatile setting. Everybody, pet parents are emotional when they come in to an emergency
For
clinic.
sure. Yeah. There's so much emotion that's going on.
Yeah. Yeah. Well, tell me more about Naked Pet and what you have going on over there and the telemedicine that you're doing. All right, pet parents, you already know that I talk all the time about needing to stop as much as we possibly can feeding our fur babies garbage. For lack of a better word, that's what we talk about here a lot. And again, doing the best we can, that is the message above any and everything else. The more we learn, the more we know we need to make some changes. And this episode is powered by Legacy Biome. This is no BS. And this is why I think you need Legacy Biome. So, Legacy Biome offers premium. When I say premium, I mean premium FMT, fecal microbiota transplant capsules. These are products for your dog designed to restore and support a healthy gut microbiome. Yes, you heard me. Top tier microbiome therapy straight from nature's playbook. Gut health isn't optional. We talk about this all the time. It's not optional. It drives digestion, immune strength, allergy resistance, mood, and even chronic disease risk. So if your pet's gut is out of whack, their whole system is out of whack. If you've learned nothing from me thus far, I think you should know that. So Legacy Biome tells us that their donor animals live on a raw, organic diet in pristine, chemical-free environments, generations bred to preserve a rugged and unaltered microbiome. No antibiotics, no pesticides, no synthetic crap, ever. And they screen those donors with the strictest protocols in the industry. Kim's over here next to me, if you can hear her. So, if you have a pet that is wrestling with chronic diarrhea, itchy skin, hair loss, allergies, rebounding from antibiotics, that's a thing too. Legacy Biome is your weapon. Heck, you can just use it proactively to build a bulletproof gut and immune health. So don't worry, vets handle this. FMT is administered rectally often through veterinarians' offices, but we don't always have access to that. So, what's the next best thing? FMT capsules that are enteric coated that you can get delivered straight to your home from the most pristine donor dogs ever, from Dr. Margot Roman, as a matter of fact. So, top integrative vets across North America swear by Legacy Biome. That's not hype, that's physician grade endorsements. If you're ready to stop the gut wreck and start the comeback with your dog, head to legacybiome.com. That is legacybiome.com, legacybiome.com, and get some for your pet. And by the way, let me know how it goes. You know me. You can always reach out to me on Instagram. I'm here to talk to you all the time. I want to know. Let me know about it.
To try Legacy Biome for your dog, visit legacybiome.com and use code TPPR10. That's TPPR10 for 10% off.
Well, tell me more about Naked Pet and what you have going on over there and the telemedicine that you're doing.
Yeah. So Naked Pet was kind of me expressing my frustrations through a website. So in the integrative holistic side, kind of alluded to earlier, I'd say the number one thing we were seeing is the extreme rise in pets with allergies or at least skin and GI based disorders that were rooted in immune dysregulation.
Okay.
And so, with that being said, I said earlier that I kind of fell the path of educating myself and then started talking about it, through different means. But eventually, I felt like I should try it to, join the vet community that's trying to make a difference with that, even though, I don't really have a space to do it at the moment. So, meaning like the emergency room, like that's not the space to do it. So I was like, all right, well, I guess I see a couple other people doing things. I started to, I actually was working with a telehealth company that's for conventional medicine. And I was like part of like their research aspect. So I kind of got exposure to that for a little bit and understood where more telehealth, it's a weird discrepancy again, kind of like the cannabis thing, but the verbiage
Yeah,
in the telemedicine or the telehealth space. You have teletriage, you have telemedicine, you have teleradiology, you have a bunch of things that are within it.
gotcha.
But in terms of like telehealth is kind of like the overarching word that you can use that the verbiage will describe anything you do via virtual communication. And so, I was like, all right, well, I could probably utilize this in a certain way if I use certain words or I don't, make direct recommendations. We don't talk about certain topics. We could probably still talk about a lot. And so, after a year or so of researching, what I could do through telehealth, and in the same vein, also, with the allergy side, I really understood why in the vet space, whether it's conventional or holistic, we only talk about oral products when it comes to allergies, stuff like that. Like if you have allergies as a human or immune dysregulation at the skin barrier, like a lot of people, who have that know that there's a complementary topical treatment side to also the oral side. It's not just oral meds you're always taking. So those two things I kind of just brought together with Naked Pet, where I helped with a very close friend who's a genius woman on the human space for holistic topical therapy. She's like paramedical esthetician and RN and very holistic minded for sure. Been friends with her for years. Like we went and worked together to create a product line for pets. And then I worked on the telehealth myself and figured out what I could do and created topics that I thought I could provide significant value to pet parents over virtual means, and then create a website and brought the two together. And so that's kind of how Naked Pet was born. So, we've kind of grown a lot since then. I added a few things, like added the titer testing to that, after the initial launch. Um, we do some more advanced testing now through a website, I'm sorry, a laboratory called VDI, where we can do like mycotoxin testing or gut health testing or um, even there's some cancer screening testing that they have to there that you could sometimes do, heavy metal testing, through um, certain means. It's kind of expanded since I started out where there was just a couple of consults and, the Naked Pet products. We have a huge oral product company kind of affiliate group that I've slowly vetted over time, added one company a month at a time that, because I don't really want to get into oral products. There's a whole laundry list of reasons why, but stick to the topical, stay to my lane on that side. But, obviously, I use a lot of supplements and nutraceuticals through the telehealth to kind of help pets, as, whether pet parents are looking to get away from pharmaceuticals or try to minimize the amount that they have to give on a daily basis. So, but yeah, it's kind of expanded into a three-arm kind of situation with the telehealth kind of being the center of it, the topical therapy line, being utilized in, I would say at least 50%, 75% of the pets I see through that through the consultation side. And then slowly trying to create a collected safe space of products that I've personally vetted for safety and do believe are effective to utilize through the telehealth space. Whatever supplementation I think is necessary in complement to proper diet.
Yeah, I'm so glad you said diet because I was like, that's where I was going
Yeah.
because
Yeah,
I
that's the foundation of everything.
it really, really is. And I mean, I that's the universe just brings you what it brings you, and you're like, okay, I guess this is what I'm doing. And I mean, most of my clients are leaky gut. Mm, I have so many dogs with SIBO. Shocked at the number of dogs I have with SIBO. And it's just like, can't do anything without addressing the diet first, especially with these dogs that can hardly eat anything.
The hour and a half, depending on what consult we do, you know, at least 30 minutes, at least half of it or more is just about either what diets haven't worked, which diets we could try, which ones we have left, which proteins are left, which, do we need a cooling, warming, that takes at least 50% of the hour and a half every time. So I definitely agree with you. It's the foundation, but it's also the least talked about, I think, in other settings outside of like, maybe what you and I are seeing, like
Mhm.
people seeing us. So it's the least.
Yeah, well, it's so individualized. It's hard to put that kind of content out, I think, because it is so individualized. It's easy to put a supplement or a nutraceutical out and say, this will do all these wonderful things. Buy it.
Yeah.
Right? It's
Unfortunately, I
easy.
agree. When too much, everything's the next best thing.
For sure. For sure. So I guess you're still doing the telehealth currently? Is that a thing you're
Oh
still
yeah,
doing?
yeah. No, yeah. We kind of initially actually we got overwhelmed. We had too many consults at once, so we published the consultation schedule 1 month at a time, so that because we put out like 3 or 4 months and we're booked. So because
Gotcha.
I work in the clinic 20 to 22 days a month, give or take, and I'm usually flying between on my off days or either flying or something. Actually, many times on my on days as well. So we try to, I basically fit it in on any of my off days. It's really when I do the consults or the hour before I'm about to go work a 14-hour ER shifts, So I'm
Goodness.
basically fitting into that. And but yeah, no, 100%. We do it all the time. We right now is the hot season for the titer testing. Actually, right February to April, because a lot of people are doing their wellness exams with their pet parents, which is actually I do support that. I think that's the best time of year to do it. And before they go to see the vet or they're planning to go see the vet, the titer testing is a blood draw. So they're like, all right, well, I'm going to go to see the vet anyway. So I'm like, that's perfect time to do it. And so we've gotten a couple dozen of those, over the last 2.5 months.
Yeah.
Yeah, no, we still do it all the time. And, you know, um, uh, I think that most pet parents walk away with that feeling like they were heard, number one, and that they got some sufficient value out of it. So for the most part, I hope at least.
Yeah. I mean that's something that we don't talk enough about, like for sure, being heard.
Mhm.
That's what I get so often from people is like, I'm just glad you listened to me.
Mhm.
Like and didn't shrug them off, didn't say, "Oh, it's nothing, don't worry about it," or "Let me just give you this pill." Like, actually like listening to them.
Mhm.
Because the bottom line is that yes, vets are trained, you, all of you, y'all, are you're trained and you see so many animals that you see trends and you can put all of that together, but like nobody knows an individual animal like their owner does.
Yeah, no, for sure. I definitely agree with that.
Yeah. So I want to thank you so much for your time and just ask like if there's anything else that we didn't cover that you wanted to talk about or anything that you want to say to people listening about their pets or about what you do.
Yeah, no, I mean, I think that actually that was a kind of a good segue to closing was that essentially you're going to find people in every walk of life that you associate with or you feel you can assimilate to. So the same goes for your pet's health and wellness. I think it's good to be for sure, like we talked about, an educated pet parent as best you can. And, when it comes to kind of consolidating where, you take all these things that you're hearing and you're looking up and then trying to find what's best for your pet, finding, you know, pet professionals that are in the same thought category as you, in the same interests and goals as you, which can be harder than it sounds. But
Mhm.
trying to find that as best you can is a good place to start because you know, like I said earlier, you're not going to find people that you associate with just right away everywhere. So, not being afraid to, try to find that person that in the vet space that is going to listen to you and want to work with you as a pet parent when you're trying to do your best. Because I think they do exist in all 50 states. You just,
Yeah.
maybe have to find them and, it may take a little bit more work, but I think they do exist and they're out there for you.
Yeah. Well, I appreciate that. I appreciate you and your time and wanting to expand beyond just what you learned in vet school. I appreciate that so much for our pets, especially. So, thank you again. You guys listening. I want to say thank you to you for being here, for listening. Make sure to check the show notes for any links for anything that Zach talked about, and just give your pets some extra love from both of us this week. And I'll talk to you next week.